We have Dr. Katherine Davenport returning to the podium from our Phoenix Children's Hospital. Katherine's going to talk to us about injury prevention in the pediatric population and does it make a difference. Thank you.
All right, thanks again. Hoping to just take a look here at injury prevention as it specifically applies to pediatrics and the effect that it either does or doesn't have globally and then specifically to Arizona. So Dr. Koop was one of the sort of founding, I hate to ask, oh there we go, it's back. One of the founding fathers for the field of pediatric surgery and specifically for trauma as it applies to pediatric surgery and specifically for injury prevention. He actually lost sort of a young adult son of his own, and I think that's likely where he developed his love and attention toward injury prevention in children. And he was really instrumental in the development of the field toward injury prevention in kids. So I'm going to just touch a little bit on some established injury prevention strategies that we're all very familiar with that have been successful nationwide and globally in some instances, and then touch a little bit on some specific statistics in Arizona as it applies in recent years. So as we all know, injury is the leading cause of death and disability in the pediatric population. Trauma systems do a really great job at providing the best care, but if we could prevent it from happening at all, then we would all be happy to not be a part of it. Prevention strategies should be tailored to the target population, and of course we have to study it in order to do the best job we can to prevent it. So these are a handful of really well-oiled prevention strategies that we all know a lot about. Child passenger safety, this is the booster seats, this is wearing seat belts, this is doing the best for getting kids in cars safe to the next destination. Helmet use for wheeled activities, fire safety in the home and in buildings, and then storage of firearms. Motor vehicle collision is the leading cause of death in the bulk of the pediatric years in the United States. It's one of the most dramatic examples of the efficacy of injury prevention strategies is child passenger safety efforts. This is a sort of archaic chart, but globally here what we know is that research shows that seat belts and child safety seats do save lives. This shows that from the period of time from 1980 to 2007, there's a general decrease in the mortality for child passengers, and this is in general the time period in which case the seat belts and child safety seats became mandated. And so it shows that there is progress. It's not totally eradicated, but it makes a difference. Seat belts reduce the risk of fatality for front seat passengers by almost 50%. Child safety seats reduce the risk of fatality for infants by more than 70%, and that for toddlers by more than 50%. The challenge, however, is that we make sure that every passenger wears it properly every time they get in a car, and we see this every day at our hospital that is not the case. The efforts in any type of instituted program needs to include education, distribution of the product, and appropriate legislation in order to make all of this happen. And really the best way to do this is a combination of all three of these arms. This is just one example. The CDC actually does a really great job of education. This is just one example of how they distribute the information of how car seats should be worn, should be installed, should be used. I didn't pull down the tab well enough, but there's 4 tabs within this website, and it gives you statistics. It's written for the lay public. I don't know who visits it besides myself, but you can see on the left-hand side of the screen, it really covers a lot of opportunity there. And for example, there's some tips here on safe driving in tribal communities, which really only applies probably to us. So the next category here is fire safety. As you all know, smoke alarms is the single most important piece of safety equipment to prevent fire-related morbidity and mortality. Your risk of dying in a residential fire is cut in half if you have a functioning smoke alarm in the house. Second to that is identifying an escape plan, just in case if you were to have a fire. And then coming behind that is the development of flame retardant or flame resistant clothing for kids, because we know that half of individuals who are going to start fires are people under the age of 5. And then not far behind that are legislation or laws regarding smoke alarm standards, sprinklers, and then cigarette lighter or child proofing for cigarette lighters. And so these are all really great efforts that have come along and made fire safety much improved. With regard to firearm-related injuries, this is an area that has made some progress, but there's certainly a great deal to go. This is something that's a real hot topic in society these days, and partly because it's a real high fatality area, and prevention is vital. We all know that presence of a firearm in the house certainly leads to a risk of unintentional firearm death, suicide, homicide, compared to homes without firearms. There's a lot of controversy over the effectiveness of educational programs for children because there's some concern that this leads to persistent curiosity. In surveys of parents who have guns, there's a wide variety of how guns are stored. The guns are unlocked, guns are loaded, guns are unlocked and loaded, guns are locked or unloaded, and only less than a third of the time. In the same survey where they intervened with education and counseling, it did show improvement in how guns are stored. However, the follow-up to that didn't show any improvement in the injury related to that subsequently. And so there's a lot of variety or instability in terms of how this particular program or intervention for firearm-related injuries has really come about, and so there's a lot of work yet to be done with this one. What we do know is that the protective effect in terms of the risk of youth with unintentional and suicide firearm-related injuries is what you would expect. Guns that are locked and unloaded and storing your ammunition locked and separate from the firearm are protective, of course. And then everyone knows about helmets. Helmets have made such a big difference in terms of protecting against serious head injuries and facial injuries. Helmets have really been instituted as part of the paradigm over the last 10, 20, even 30 years for bike riding, any wheeled activities. It's really become part of an educational initiative as far as a legislative mandate in most states, and it's really made a real difference in terms of decreasing the number of head injuries and the serious nature of head injuries for children. So with all that in mind, those are just examples of really good programs. How are we doing at home? And so Arizona has a group called the Arizona Child Fatality Review Program, and they're a group that evaluates or examines all of the deaths per year across all boards. So these are trauma-related deaths, these are neonatal deaths, these are prenatal deaths, these are all deaths of children in the state, and they put out an annual report, and it's a 130-page document, and they look at it at all angles, but the bottom line, or where our interest lies, is in the preventability of these and how can we make a difference. And so the bottom line is that we do have a role. There is potential here for doing a better job, and in terms of doing a better job from a prevention standpoint. And so this is a top overview of all of the information that they have from the last one that they reported, which was the 2016 data. And if you look at this chart, they've divided all of the information they had from 2016, age 0 to 17, by manner or other words, mechanism. And they've divided it into essentially unintentional death, suicide, homicide, undetermined. And the vast majority of these, other than what they determine natural death, are otherwise what they call preventable. So you can see that there's a lot of opportunity here for what they call preventable death, and these are otherwise situations where you can have an injury prevention program or opportunity here to make an improvement. Similarly, this is the same pool of data, the same collection of children who died in the state of Arizona for 2016, and they've just divided it by age group. And so on the far left, you see the young children, birth to 1 month, all the way on the far end of the screen are the older teenage kids, and rising is the percentage of preventable deaths that they've deemed by evaluating this group of population. And you see, again, large categories within there, up to in the mid-20s percentage of preventable deaths. So there's a large fraction here with opportunities for prevention or improvement for making a difference, even with these great programs that we know about that we have in place. So within these groups, I've gone through the report and I pulled out some areas that we know from a trauma population and trauma programs that fall within the categories of trauma departments. So they call one maltreatment deaths. We think of these as child abuse or suspected neglect and trauma. They call another category MVC or other transport modalities. And then a third that we're all familiar with is firearm-related deaths. Ignore all the busyness. I just wanted to pull it straight from the report so that you can see what we're working with here. In their overriding review of the report, under the category of child abuse or maltreatment, just look at these buzzwords. In general, maltreatment decreased by a smidgen, by 6%, but in general, everything is preventable, so determined by the team to be preventable. As we know, those of us who work with these kids all of the time, the vast majority of these, or I'm sorry, not vast majority, but at least 65%, the perpetrator was the mom or the dad, and substance abuse was a large factor. This is a graph showing the trend over the last 10 years for mortality rate due to these maltreatment children. It shows that it's going the wrong direction. There's an increase in the mortality rate with these kids, and so it shows that certainly there's a room here that we need to make improvement, and then the question is how. This is a table showing preventable factors. It's titled Preventable Factors. These are the lists: substance abuse, lack of supervision, unsleep safe, lack of proper restraint in a motor vehicle, high percentage involved, multifactorial for many of them. These are all things that in general, those of us who work with these kids all the time, it boils down to just needing like higher index of suspicion. We know that it's not like anybody was negligent in knowing these children, but we just know that we have to keep an eye out for it and be vigilant. This is another heartbreaking chart here. This is the maltreatment deaths for any of these children. On the far left side, no CPS involvement in kids. So 1/3 of the children had not been flagged through the CPS system. The middle bar there shows there was a history of CPS involved in the house, and the green bar shows an open CPS account at the time of the death. So 2/3 of these children were involved with CPS, either active or closed or in the history at the time, which is amazing to think about. So this just also falls into the category of needing a high index of suspicion. This all, in my mind, falls into the category of preventable injury and room for improvement. So another broad category within this annual report is MVC and other modes of transportation. So again, just focus on the red line. So the deaths decreased 42%, which sounds huge, but accounted for 10% of all pediatric deaths in 2016. The deaths were deemed preventable, as we know, and passengers accounted for 64%. So if we think about who the passengers are, we feel like we've got some opportunity for improvement there, and there's a real difference, as we'll see in a chart here, between who dies in the car when a teenager's involved, passengers versus drivers. This came straight out of the report here. These are all preventable risk factors. Improperly or unrestrained children, they weren't wearing helmets, substance abuse involved, not supervised, excessive speed, distracted, we've heard about over and over, reckless driving, all things that we can work toward, all things we are working toward, but need to do more of because we're still watching kids die. This chart, again, like before, a 10-year period of time. In general, the curve is moving in the right direction, but in the last 2 or 3 years, the curve's moving in the wrong direction. It's not that we're being negligent, it just means to me that there's more work to be done, and that just falls in the category of injury prevention. This chart just shows number of motor vehicle deaths broken down by age. It happens in the really young categories of 0 to 4 years. It happens in the older teenage kids. Part of that is just by physiology and size of the child, probably improper restraining, in terms of the car seats, and then in the older kids it's because they're drivers or passengers of teenage drivers. This chart is broken down by location within the car. This is what we were talking about, or as a pedestrian. So vast majority of these are passengers in a car. And again, this is another chart talking about your preventable factors. So this all just falls under the umbrella of so much prevention opportunity we have for these deaths within the state of Arizona. And then lastly, this category of firearm deaths. So it talks about how we decreased from 29% in 2015, but talks about, again, everything's preventable. Drug abuse was involved, happens in the older teenage kids. These are all things that we know about. These are the things we watch on the news. This is the curve as we watch. There's an uptick in the last 3 or 4 years. Again, room for improvement. We know what happens in the older teenage kids. Again, here's a chart of preventable factors, things that we can hit upon. Substance abuse happens in more than half of them. The guns not stored or they are unlocked, things that we can do something about. And then again, these are opportunities or prevention recommendations. This is a part of that annual report in every category. And so they really nailed home in this section. Pediatric mental health resources, more mental health screening, lock up those firearms, safety training courses, gun safety education. So in general, in conclusion, as a society, we do a really good job of pediatric injury prevention. We're making really great strides, but in general at home, we have a lot of work to do, and we're keep doing the good things that we're doing, but there is still room to go. Really have to work from all those angles: education, distribution of products, legislation. It's all working well, but have to keep working.